Well, my friends, what I what I am telling repeatedly, every now and then, the same thing, the same formula, the principle of homeopathy, the ideology of homeopathy, the doctrine of homeopathy, the system of homeopathy is entirely depend on totality, individualization. Every man of this universe is differs from one after another, one to another. So treatment should be, so treatment should have every person, every patient, every individual individually and not in generally. This teenage boy, aged about 16 years, is being a victim of acne, a severe variety of acne for which he has been suffering for last few years. Now, in addition to these acne vulgaris, he has also developed some other varieties of skin diseases here and there. Skin diseases on palms, soles, and also here and there. So many times I have demonstrated what is acne, Bruno. Well, my friends, I have already told and demonstrated that acne is a chronic inflammation of the sebaceous glands of skin. Chronic inflammations of the sebaceous glands of skin. It starts after adolescence, and by the age of 25 approximately, most patients stop to formation acne. It is caused due to increased secretion of the sebaceous gland, leading to increased oiliness of the skin. So, it appears in the subjects whose face is much oily, যাদের মুখটা বেশি তেলতেলে থাকে, sebum secretion বেশি হয়, তাদেরই বেশি দেখা দেবে। The oiliness of the skin is caused due to breakdown of the lipase, which produce large quantities of 3 molecules of fatty acids. These fatty acids, along with other components of the sebaceous secretions and with bacteria, produce acne. So both the androgens and progesterone hormones of both the sexes, male and female, are responsible or help to increase sebum secretions. It usually affects the face. It usually affects the face, most frequently on the cheeks, but also involve the forehead, over the nose, the chin, upper part of the chest, and sometimes on the back. Now, due to excess secretion, the sebum, which is known as seborrhea, there is greasiness of the skin of the face, মুখটা তেলতেলে চকচকে হয়ে যায়. According to size, there are variety of names. The common variety is known as acne vulgaris, and this is the common variety. It is known as acne vulgaris. The kind of lesions are of two types: blackheads, that is open comedones, and whiteheads, that is closed comedones. The lesion keep healing and recurring and leave behind pigmentation or scar or small keloid, like অনেকের মোটা হয়ে কিলয়েডের মতন থেকে যেতে পারে সেরে গেলেও. Acne worse when applied oils or other greasy applications. তেল ক্রিম এসব বেশি লাগাবে না মুখে। So greasy application to the face or hair. It also aggravates at the period of emotional stress. It is related with the stress, emotions, anxiety, worriness too. Aggravation during menstruation is also due to excessive secretion of estrogen and progesterone, the two sex hormones of the females. Now the patient, what should be advised to the patient? Many of our homeopathy doctors do not know how to advise, how to tackle, what are the auxiliary measures of treatment part. The acne patient should be advised to wash the face at least twice a day with normal soap and should apply normal shampoo the hair daily as far as possible and avoid greasy cosmetics and hair oils. So this is all about the physiology or mechanism of acne. Now what will be our prescription, my friends? Allopathy doctors, the subject has been suffering from the acne vulgaris and itching here and there. So they will apply some ointments, etc. So in homeopathy, our prescription not depends on these acne and eruptions here and there, but by the symptom totality. What is the totality of the child, of this adolescent boy? He has already treated by ointments. So there is suppression, number one. Number two, has an aversion to bath. He doesn't like to bath every time. He doesn't like to pray every day. So these two symptoms are important and in favor of brimstone. So brimstone has an aversion to bath and already applied ointments. The third important symptom in favor of brimstone is tremendous desire for sweet. Tremendous desire for sweet. মিষ্টি খেতে খুব ভালোবাসো বলেছ? মিষ্টি খেতে খুব ভালোবাসে। আর জিনিসপত্র ছড়িয়ে ছিটিয়ে থাকে তোমার পড়ার টেবিলের বইপত্র, পরে করবে বলে মনে করো আর করা হয় না। So not neat and clean and tidiness. So this is also another symptom of brimstone. চান করতে রোজ না করতে পারলে হয়, না করলেও কোনো অসুবিধা হয় না। অনেক সময় ইচ্ছা হয় যে আজ করবো না, এরকম মনে হয়। So has an aversion to bath. So our prescription differs from allopathy. Allopathy treats only the acne, the disease condition. We treat the patient as a whole. We do like to treat the patient holistically. We do like to treat the patient individually. We like to treat the patient in general. Now, not only differs from allopathic physicians, we the classical homeopaths, we the Hahnemannian homeopaths also differ from some bastard homeopaths. What the bastard homeopaths? The bastard homeopaths are those homeopaths who do not follow the Hahnemannian instruction and mixes homeopathic medicines one after another and does polypharmacy. They are the bastard homeopaths. And nowadays, the number of bastard homeopaths are day by day increasing. And Dr. Bidwell said correctly, in the days of therapeutic nihilism, when so many bastards are being fostering as a homeopathic, its survival will come through only the comprehensive study of organon. So we differ from bastard homeopaths. I mean the homeopaths do not take the case taking, do not analyze and evaluate the symptoms, do not interpret the symptoms, cannot prescribe a single medicine at a time, cannot repeat the medicine when the former action is exhausted at a particular time. Those who homeopaths are bastard homeopaths. The bastard homeopaths will never prescribe brimstone in this patient. They will mix some other tinctures or patent like this, but the classical homeopathy all will prescribe in this case a single medicine, brimstone, in 50 medicine scale of potencies. With the direction I have given brimstones 1 to 6 with the direction twice in a day, morning and evening, and with the advice to maintain and clean the acne to the patient. I do hope by this single medicine, this adolescent boy will be happy and his acne will be cleared up. Are you agree, Miss Munni, with me?
Yes, sir.
Brimstone is the choice of
Medicine.
So let's see the result, my friends. Please remember this video number. I shall share you the result.